Hi, I'm Steve Hines from Peak 15 Fitness, and I'm a chartered physiotherapist, and I work out of a practice in Balham in southwest London called Recentre. Now, I use acupuncture as part of my practice, and many physiotherapists nowadays use acupuncture. And unless they've been trained in traditional Chinese medicine, most physiotherapists will use acupuncture to reduce pain and to reduce muscle spasm, muscle tension. And one of the questions that I oftentimes get asked is, how does acupuncture work? Now, in traditional Chinese medicine, they believe that pain or disease is a blockage in the flow of energy through these meridians through the body. And simply needling the points along these meridians helps to stimulate the flow of energy through these points and can resolve pain and disease. Now, this philosophy doesn't always fit with Western medicine, and we know now from scientific research that there's a few mechanisms at play that help to support what the Chinese have been doing for thousands of years. So we know that putting the needles into the skin stimulate the brains to release its natural pain-killing chemicals, and these diffuse out into the nervous system, bind onto pain receptors in the brain and help to just dull that pain message going up to the brain. Another mechanism that we know is that by putting the needles into the skin and stimulating or twisting those needles creates a wall of tissue around the needle tissue interface, and that can cause tension to radiate out from the needle point, and it almost acts as like a mechanical stretch along a fascial plane where you've put these needles in. So it almost stretches muscles and soft tissue. And then obviously putting a foreign object into the body creates a increased blood flow into the area. With an increased blood flow, you get more immune cells into the area, which can clean up debris and increase the immune activity in the area. You get increased oxygen and nutrients and an increased removal of waste. So it may just speed up healing in a particular area. Now, people often ask, is acupuncture painful? Well, it's not completely pain-free, but it also shouldn't be extremely painful. If your acupuncturist firmly and quickly taps the needle in through the skin, then you tend to bypass a lot of the pain receptors which are in the skin, which could make acupuncture quite painful. If you get something as innocuous as a paper cut, you tend to slice right through those pain receptors in the skin, and it can be quite sharp. Now, when the needles are inserted, they're inserted to a depth where we're trying to stimulate what the Chinese call de qi, which in Western terms we would know as an ache, a soreness, or a slight tingling sensation in and around where the needles have been inserted. And this would denote that the acupuncture is having some kind of effect. Now, physiotherapists will treat many conditions using acupuncture, typically things like neck pain, back pain, sciatica, and tennis elbow. And it's worth having at least 2 or 3 treatments. One session generally doesn't do a great deal. You might feel slightly better, but it doesn't tend to resolve the problem. So it's worth sticking with it for 2 or 3 sessions. If after 2 or 3 sessions you're not responding to it, then it's worth trying some other type of physiotherapy, because they believe, or research has shown us, that around 70 to 80% of people respond to acupuncture. Clinically, I'd suggest that maybe 80 or 90% of people respond to it. But again, if you're not responding to it, then talk to your physiotherapist and have some other kind of treatment. So if you've got neck pain or back pain or tennis elbow or sciatica, and you'd like to receive some acupuncture, then come and visit me down at Recentre in Balham, and hopefully I can help resolve your problem.